Mr. Karan Johar is in news again, and this time for a medical reason. He has lost a lot of weight and he's looking totally amazing. And this has happened not just with Mr. Karan Johar but with a lot of Bollywood and Hollywood celebrities. So let's talk about how did Mr. Karan Johar lose so much of weight. A lot of buzz has been going around this that he has probably used some weight loss pills. So the idea is I would be talking about the weight loss pills as to how do these weight loss pills make you lose weight. That is one. The second thing I'll talk about is the side effects. And third, I will tell you a way to understand whether you are the ideal candidate for these weight loss pills or not. So let's begin by how do these weight loss pills make you lose weight. So let me tell you that these drugs or weight loss pills were actually not developed for losing weight. They were actually developed as a drug for treating type 2 diabetes. And it was found during the clinical trials that these drugs have a side effect, that is losing weight. And how do they make you lose weight? There are 4 ways by which they make you lose weight. So most of these weight loss pills consist of a molecule known as semaglutide. This semaglutide does 4 things and therefore leading to weight loss. So the first thing that it does is it suppresses the appetite. It mimics a hormone known as GLP-1, which naturally is produced in the gut. But here this mimics this hormone and signals the brain that you're full, and thereby leading to lesser appetite, you eating less, and thereby lesser calorie intake. The second thing it does is it slows the gastric emptying. That means the food stays longer in your stomach, therefore you feeling full and not wanting to eat food again, thereby again reducing your calorie intake. Third, it controls the blood sugar level. For people with type 2 diabetes, it controls the blood sugar levels by increasing the insulin secretion and lowering the glucose production in liver. Stable blood glucose levels can prevent hunger spikes caused by the blood sugar dips, which can otherwise lead to overeating. Fourth, improved metabolism. By improving insulin sensitivity and glucose metabolism, it can also improve your metabolism, thereby leading to weight loss. But along with these effects, there are certain side effects of these weight loss drugs which one should know before even thinking about going for these weight loss drugs. So let's talk about the side effects that are there with these weight loss drugs. So what all can be the side effects of these weight loss drugs? First are the gastrointestinal side effects, obviously because a lot of it is related to the stomach. You can have nausea, vomiting, diarrhea, constipation, abdominal pain, even fatty or oily stools, because fat is not being absorbed and it is lost with the stool. So those stools can be really oily and fatty. So second is the headache and dizziness. Third is increased heart rate and blood pressure. Fourth is fatigue and weakness because food is not being absorbed properly and it can lead to a lot of tiredness. Fifth are the sleep disturbances. Sixth are the mood changes and anxiety. Seventh, another very important side effects to a few people, it can also lead to the gallstone formation because of the abnormal absorption of fat. Eighth is hypoglycemia or low blood sugar, leading to dizziness or fainting, like a low energy kind of effect. Then are the nutrient deficiency because fat is not being absorbed, so a lot of fat soluble vitamins such as A, D, E and K are not being able to absorb and leads to their deficiencies. Then you have the pancreatitis in a few. 11th, it can lead to kidney issues in the form of acute kidney injuries. Some people may be allergic to the drug, so that's number 12. 13, there can be suicidal thoughts in certain younger individuals. 14 is long-term risk of, especially like these drugs, if overuse, can lead to a lot of disastrous effects. So one of the important considerations before using these drugs are that, one, they should be used under medical supervision and they should not be self-administered. Second is that lifestyle modifications, if used properly with these drugs, then only these drugs can be effective. It is not for everyone. You need to know how to calculate your BMI. You should be able to take help from a medical practitioner. How do you calculate your BMI? Because these drugs are typically for those people whose BMI is less than 30. And how do you calculate your BMI? I have a video related to that in which you can know how to calculate your BMI. So if you find this information useful, please share it with as many people as possible. Don't forget to like, share and subscribe the video. Take care, stay healthy. Namaskar.